Have you experienced that where you have a patient in a coma for whatever reason, either like a bleed or it was medically induced, and the family doesn't understand why, like the moment they wake up, they're jumping out of bed, doing backflips down the hallway?
Yeah, no.
That's good.
That hasn't happened.
That's good because actually, funny enough, in all my research for all the topics that we're talking about today, I didn't find a movie or a TV show that did a good job of depicting a coma. I mean, some of the other stuff that we're talking about, I have a counter to.
Right.
I have things that did it bad, I have things that did it good, and a coma was one that was across the board kind of exaggerated for dramatic purposes.
Hey guys, welcome to another episode of Brain Buzz, where we delve into the fascinating world of neurosciences and brain health. I'm your host, Dr. Kimon Bekelis.
And I'm your co-host, Jason Wallen.
We thought about talking a little bit about how folks perceive neurosciences and brain health, and I think most of our perception comes from movies,
Yeah,
and theater and Hollywood and TV, and a lot of it is, of course, if you're not in the medical field on a day-to-day basis and you don't see what brain problems really constitute of, your perception will probably be shaped.
yeah, and we've done a couple short segments. We looked at I think movies like Doctor Strange and TV shows like either Grey's Anatomy or House MD, and we get a lot of feedback from our listeners, and I realized that a lot of people, like you had mentioned, lay people, take what is entertainment, and some movies do it right, some TV shows do it right, and some do it wrong, and we were focusing on the wrong. So this kind of segment will be a mix of the two, and you can give us the factual breakdown as we go.
Right, and I think I'll start with the one that's most commonly misconceived, and that's coma.
Yeah, it's a big one.
I think it's, of course, a very dramatic, an opportunity for a very dramatic transformation in a movie or a show, yes. And as such, it's been taken advantage of. As neurosurgeons, neuroscience providers, we see people in coma all the time, and coma can happen because of two reasons. One is an artificial coma, where we put the patients on medications, and because they're on meds, they cannot really communicate with the outside world. And that makes them unresponsive, and of course that they fall into a coma. Or there might be an internal problem of the brain, so not an externally induced state, but more so an internal problem where there's some sort of trauma, brain injury, stroke, brain bleed, something that's impeding the brain's ability to function, and the level of alertness is low, and of course the patient cannot communicate. That's another form of coma. Now, when you're getting out of the former type of coma, meaning the medication induced, of course you're still the same person. As long as there's no insult to the brain, as long as there's no injury to the brain, you're still exactly the same person. I'm sure with the same skill set. Definitely not enhanced. And when that happens, you typically are not able to perform your physical skills at the same level because you're exhausted, because you've been on medications, and I'm sure you had other medical issues. But in terms of the brain, it's still there. There's no issues. Now, so that's one type of coma. That's generally not the one depicted in the movies. Would you agree with that?
Correct. It's usually like somebody was in a car accident. Somebody
Right.
was. I mean, you see extremes like somebody was shot in the head, and then they were in a coma, or like a show Walking Dead, where the guy was in a coma based upon an accident and then wakes up, and they're perfectly fine. Or even Kill Bill is another movie that's pretty popular that shows this lady who's been in a traumatic accident.
Right.
I think she was shot, and then wakes up for 4 years too, which is kind of comical, and then just starts fighting like ninjas for a couple of movies.
Right. Right. That would be extremely difficult, and of course, every day you spend in a hospital bed, connected to a ventilator, in a coma, translates into substantial time in rehabilitation to be able to regain the muscle mass you're losing. So that depiction is, of course, exaggerated and definitely not expected. Also, in those cases of severe traumatic brain injury or a stroke or bleed, even when folks eventually regain some level of communication with the environment, it's not the same functional level as they were before, and certainly they don't have the same skill set. They might have some level of weakness. They might need rehabilitation to regain even part of their function. So I think that's one of the most widely abused ones.
Have you experienced that where you have a patient in a coma for whatever reason, either like a bleed or it was medically induced, and the family doesn't understand why, like the moment they wake up, they're jumping out of bed, doing backflips down the hallway?
Yeah, no.
That's good.
That hasn't happened.
That's good. Because actually, funny enough, in all my research for all the topics that we're talking about today, I didn't find a movie or a TV show that did a good job of depicting a coma. I mean, some of the other stuff that we're talking about, I have a counter to.
Right.
I have things that did it bad, I have things that did it good, and a coma was one that was across the board kind of exaggerated for dramatic purposes.
Yeah, it lends itself to that, though. It comes from somebody who's there trapped in a body all of a sudden is out and about and is able to fight crime or fight zombies or whatever it is that needs to happen. So it's very ripe for that as a condition, although it's a very dramatic condition, and dramatic as a condition, but traumatic for the family and the loved ones of the person who's there but not able to communicate with the environment. But certainly from Hollywood's perspective, I think this one has been abused and will continue to be abused because it's lends itself to it.
Mm-hmm.
Another one, I would say that maybe we should consider talking about is amnesia or memory loss. Right, equally dramatic.
Another good plot.
Yeah,
plot
equally
point.
dramatic. Somebody loses their memory in an accident. They're living another life. And all of a sudden, that memory comes back, and they're back into super spy mode or super soldier mode or whatever it is that saving the world again offers for that ability to over dramatize a plot. But that's not really how it works, right? So when we're dealing with memory loss or amnesia, there can be a couple of situations, right? One is you go through an episode where you forget everything. That's called transient global amnesia, TGA. It's fairly common, actually. And when it resolves, you're back to being the same person you were before without any issues. Now, if the amnesia or the memory loss is the result of brain trauma, although you might regain part of your memory, you might not regain the majority of it. Depends on the severity of the trauma. If we're talking about a simple concussion, you'll be able to return to who you are if you have some amnesia related to it. But sometimes you might never remember the events surrounding the concussion. Those are the first memories to never be stored. And so definitely one that's tough to also reconcile with reality. I've never seen a situation where somebody loses their memory, say because of an accident, and then all of a sudden the memory comes back and they have all their skills and information and everything else is like another day has gone by.
The Bourne Identity,
right.
Or the Bourne series, because I think there's more than multiple movies,
right.
Is kind of one that uses total retrograde amnesia. He doesn't remember anything, but then it turns out that he's like a super spy, able to knows all this combat stuff, multiple languages, and it comes back like as needed, which is very, very plot convenient.
Yeah, no, that's not possible.
Now, one movie that I found that kind of did it a little bit right, partially, 50 First Dates, which is actually a movie that I really liked. Drew Barrymore, Adam Sandler. But it's Lucy who has anterograde amnesia because she can't form new memories because of an accident, and he gets Adam Sandler makes her fall in love with him every day.
Oh, wow.
It's a good movie. It's a funny movie, but it actually deals a lot with memory loss. They have a memory loss clinic they go to. Then they show all different forms of memory problems. There's a guy 10 Second Tom who literally is turning around and introducing himself as Tom to everybody in a circle every 10 seconds, and then you have people that are there because they can't function in reality because they can't remember too much. So it's a good movie, funny movie, and it actually gets some stuff right, which is good, and it's a rom-com. So
Very good. So the another one would be seizures. I think epilepsy, right? So seizures are a common manifestation of a brain dysfunction. We see them all the time in neurosciences. They have been depicted on the big screen, sometimes accurately, I would say, often accurately. Actually, this is one that there is a lot of there's a lot of good depiction of seizures that I've seen in several series and movies. Do you have a bad example of seizures?
So this one goes back because I went back and found the Dramina strain, which is from 1971. So it's been around for a while. I'm sure many people have seen it. But it has the main scientist has like a seizure that was beyond grand mal, like foaming at the mouth, violently convulsing and shaking. And that's that's part of the problem is that's what people then can base their perception upon things on something like that. And then we have a newer show, Devs, that has somebody having an absent seizure. So just that brief staring.
Right. So absence seizures are a little different, right? They're the ones where you don't really have a grand mal or a large episode of shaking.
How do you pronounce it? Because I was way off. I said absent.
That's a good way.
I would think that's how most people, not as eloquent.
Yeah, they're called absence seizures. It means absent. You're absent. You're staring off into space. It's mainly common in children, not adults. But I think, in terms of the seizures can be varied, right? I think movies have done a good service to depict grand mal seizures or the more pronounced, shaking, foaming at the mouth, like you're saying, whole body involvement type of seizure, and less so the large number of partial seizures where you can have shaking at your hand that doesn't affect anything else. You're still awake and conscious. Staring off into space can be a seizure. It can be even a visceral feeling can be a seizure. So there's a seizure is really an electrical malfunction. So many different types, and I guess. This would be a plus and minus for me because although they've done a great job at the main type of seizure, they maybe have not elucidated what happens with the rest of the seizures. But honestly, as long as there is some sort of depiction and understanding of what a grand mal seizure looks like, at least you can understand and seek care. So I would actually give props to Hollywood for the depiction of seizures.
Yeah, I mean, it's just good that people recognize that, like you said, there's a lot more common of the lesser dramatic kind that people should be aware of.
So tell me, you said you did a little research, and I can see a few things you noted down here in terms of other diseases that were portrayed appropriately, not so good, or really bad.
So I mean,
what have you found?
So when we talk about strokes, it's important to you have a lot of TV shows. Well, like House is House is a very entertaining show.
Right.
But it was very overdramatic. Where this guy could walk in and he was a walking diagnostic factory.
Right.
He would walk in and be like, "That guy's having a stroke,"
right.
Or that guy's having a bleed without having any testing done.
Right.
And we know that the reality is
that's exaggerated.
Yes, that we need to confirm things with the brain scans, brain imaging. Patient history comes into a big degree, and then the problem is that then that creates the expectation for when somebody goes to a hospital that somebody's going to recognize that they're having a stroke right off the bat, and why aren't you doing stuff?
That's a good point. Yeah.
Yeah. Another neurological condition is Alzheimer's disease. There's a movie that is really good for it. I have not seen it. It's called Still Alice. A Harvard professor is diagnosed with it, and it shows the gradual loss of memory and independence.
Right.
So that was a really good one that I found. That if you are, if anybody that you know and you want to know more about it, it really shows. It's a very sad movie,
Right.
From what I saw about it, but they do a really good job of portraying it.
Sure.
And then we have like even a very popular movie for brain injury, One Flew Over the Cuckoo's Nest, from
yes.
1975.
Yes.
They show somebody that had a lobotomy, which we know was more common in the back in the day, we'll say.
Oh yeah, it was. I mean, it was a very common treatment, and one that people thought would revolutionize psychiatric disease. Of course, they were horribly wrong, and a lot of people got injured. And certainly, One Flew Over the Cuckoo's Nest is a great movie.
It's a great movie, but the point to it is, unfortunately, that gives psychiatry and psychology a bad rep.
Right.
That they would do that. You go to the doctor, and all of a sudden they're going to be pulling out part of your brain. And for a while, that was a misconception.
Right.
That a great movie portrayed. You should never believe what you see.
That's exactly right.
Another movie was The Awakenings in 1990.
Okay.
It was mostly active for L-dopia. They had catatonic patients.
Catatonic
patients
right,
dealing with that. And it brought awareness to Parkinson's disease and neurological treatments. So that movie got it right. We already talked about brain function. We talked about Lucy, about only using 10% of the brain. We myth busted that previously.
Yeah.
But then a lot of people.
I wish it was the case.
Yeah, I know, right? Take a pill and be great.
Yeah. So I think overall, as medical providers, we're grateful to the movie industry that it portrays neurological conditions, and by as a result of that, it increases awareness. Awareness saves lives when it comes to neurological diseases, and it also removes stigma, especially in some of the most challenging diseases that have to do with memory or mental health. Of course, we always take issue with maybe over-dramatized depiction. We do understand the reason behind it. I don't think that it has detrimental effect on knowledge or on our ability to treat patients. I think at the end of the day, people understand that movies are movies. And what I would say all in all is that, as long as it continues to be done in a scientific way with the appropriate scientific consultants, which I know these studios always have, and I have a couple of friends that are working as consultants for studios, for shows and for movies. I have no problem with it. I'm very supportive, and I think knowledge is power, and the more people that are aware of all the challenges we have in the neurological world, and of course they're very interesting, that's why they're in the movies, the more the merrier.
Yeah, no, I think as long as people look at it as entertainment and don't let it, mold their perception of medicine, the average lay person, I think that if you just look for entertainment and use it as is, I think everybody will be fine.
Couldn't agree more. And with that, guys, thank you for listening in and watching another episode. We'll see you again soon. And don't forget to like and subscribe to our channel. We'll see you soon. Thank you.